Hello, welcome to Stroke Tips. This is a special for the hospitalists. Neuro Tips is for medical professionals. We provide useful information within a few minutes. When acute stroke is suspected and patient has sudden onset of focal neurological deficit, we ordered NPO, get a CT scan of the head without contrast, ASAP, and call the neurologist. We perform a quick screen exam for focal deficit, check visual field, any facial droop, slur speech or language problem, any weakness on one side. Ask the patient, family, or the hospital staff, last time patient was known to be normal, last time able to chat and talk well, able to eat, able to use the phone. Does the patient have any recent surgery, trauma, cancer, use of anticoagulant? Does the patient have recent heart attack, atrial fibrillation? Any history of bleeding in the head, in the GI and GU system? Patient will not be a TPA candidate if the last known normal is not sure or is over 4.5 hours. If the patient has recent surgery, trauma, active cancer, received a full dose anticoagulant, or had history of a major bleeding in the head, GI tract, or GU tract, they are not candidate for TPA. Level of consciousness. Most acute stroke patients are alert. They do not have decreased level of consciousness, except for very large stroke with increased intracranial pressure or with brainstem stroke. If patient is a TPA candidate, make sure that the CT scan show no bleed, glucose is okay, patient last known normal is less than 4.5 hours, and review the exclusion criteria. Give TPA before getting any other tests, including CTA. If patient is not a TPA candidate, make sure we document a swallow eval. Give patient aspirin by mouth or by suppository. Get a CTA and document the reason why patient did not receive TPA. For blood pressure management, if patient did not receive TPA, we can allow the systolic to stay below 210. Post-TPA patients' systolic blood pressure should be maintained under 180. For patient who has a bleed, systolic blood pressure to be under 140. Call the neurosurgeon if the patient has intracranial bleed, a large cerebellar infarct, because a large cerebellar infarct may compress the brainstem, or a patient has a very large right hemisphere infarct, they may need craniectomy to relieve the pressure. If patient has gradual onset drowsiness or lethargy and generalized weakness, usually these are not caused by stroke. We should consider metabolic encephalopathy or other medical problem. General medical care. Make sure that patient has swallow eval, bed rest, do not stand or walk the patient, keep patient well hydrated, and keep them on heart monitor. Well, oh boy, what a tough job, but somebody got to do it. Thank you for your attention. We'll see you again soon.